Well, hi everybody. My name is Alexis, and before I start, I want to say how honored I am to speak, and I'm so honored to be here. So thank you, Elisa and Miranda, for inviting me, and for inviting me to participate in so much of our family work and supporting ALD families. So, who am I? This is my first time at this conference, so I don't know very many of you, but I'm looking forward to getting to know you. I am a graduate student at DePaul University. I'm studying a master's in research psychology, so basically how do we study human behavior? And I'm on track to hopefully get a neuropsychology or get a clinical psych PhD to be a neuropsychologist. And so Dr. Rini Pierpont is one of my mentors. I worked with her in undergrad, and we've continued to work together in my master's program. And so that's how I ended up here, and that's why I'm excited to talk today. So today I'm going to talk a bit, we've talked a little bit about neuropsych today, actually quite a bit, it's come up, neuropsych, neurocognitive measures. These are very interchangeable words in a lot of ways. Neuropsychology is a type of clinical service that we often give to patients and we use to help understand their brain functions. And so I'm going to talk about it today about how do we use it, how do we work with families, and an outreach project that we did. And then I'll very briefly touch on how we can use it in research and then some ongoing work that I'm doing. But I'll focus on the first point by far the most. Okay, so this past year, I worked with ALD Alliance to do a family outreach project. We're trying to implement our research into the community. So research, so often it can become like, oh, look, we all are talking and we have researcher brain, but we aren't talking to families. And so we really wanted to make sure that this is something that applies to you and you actually can use in your life. And so we worked with ALD Alliance so that we could say, this is what we found and this is what we know about neuropsych opportunities. I'd like to recognize I was funded by the University of Minnesota Neurodevelopmental Program for Rare Diseases, and I'm so thankful for their support. That way we could do this project. So Dr. Pierpont and I went to ALD Alliance and we asked if we were to do an outreach project focusing on neuropsychological support for ALD families, what would be helpful? To which we got a response of what is neuropsychology. So we surveyed families, we talked to some of our family advocates, and we found out that not very many people completely understand what this service is. And this is where, as families, your input in research is so important and impactful, because I know I came to ALD through neuropsych, so to me they were one and the same. But this was surprising, and I'm so glad this was an answer that we got by asking. So what we did is we created some pamphlets that have frequently asked questions, what is neuropsychology? And we were trying to figure out what do families actually want to know? So this was not a research study, it was just a survey to families. And we compiled the questions and concerns that everybody had. So this is what we learned. So families have a huge range of understanding what neuropsychological services are. And I promise I'll define it at some point. But there's a huge range. So we have some families in Minnesota, most of our families get neuropsych testing often. Like it is really a part of just how our ALD teams care for our patients and our families that have ALD. They often go for neuropsych testing around the same times as the MRIs. We also figured out that there's neuropsychologists with extensive ALD experience is maybe not as common, even at really large medical facilities. And then we learned that families' access to this service is inconsistent. So neuropsychology is already a pretty specialized service, and so it can be difficult to access if you're in a rural area or if your insurance maybe doesn't cover it, but we still wanted to talk about it. So we couldn't target all three of these things that we learned from the families, so we decided just to target the first point, which is to educate families about the service and what opportunities are available, and how can we use this, or how can you use this in your life to care for your child. So these are those pamphlets. They are available on the ALD website, the ALD Alliance website, under psychological support. And I'll spend most of the rest of my talk kind of sharing with you what they say. So you can go read them, but you don't have to. So what is neuropsychology? So this is a psychological service that focuses on how we think, feel, and behave. It checks your brain functions and can help us identify your children's strengths and weaknesses, okay? It assesses different things like attention, learning, memory, processing speed, mood, some of those activities of daily living. And so it really is trying to get at many domains of your life, many brain functions that you have, and kind of tease them apart. Like if we're struggling with maybe reading, is it because there's not enough time to read the passages? Or maybe children are having a difficult time putting the sentences together, or it might be any one of these like assessment domains. And so we like to parse it apart because then we can help get accommodations or supports as needed. So the neuropsychologists are professional or are knowledgeable about mental health, physical health, and daily life, and then how these things intersect. Their goal is to help you and your child figure out what their brain needs or what your brain needs, and then how we can support you in your daily life. So I think it's the best. If I had to give no words to define it, or very few, I like to think about it just as these three big circles overlapping, where we've got thinking skills, mood, or feelings, and then behaviors. How is that showing up in the world? And behaviors is anything from like, if kids are acting out in class, but all the way to like, can my child like tie their shoes or make friends, kind of like we've talked about. So we really like it because it gets to those things beyond like medically to like, how is my child living? So what happens during the appointment? Patients come in, and it starts with a clinical interview. This is where the neuropsychologist will sit with you as a parent and talk through they'll ask you a bunch of medical history questions. They'll ask you the concerns that brought you in, kind of anything like that. And then your child, but probably your child will spend a lot of time doing this brain testing. So we gather like 60 to 100 data points. It's kind of a long day, but we get this really rich, beautiful picture of your child and how they are functioning. We talked about those parent assessments earlier today, and that is part of the brain testing. So we want to see like, how is your child able to be here and what are they able to do? And then also, what are you seeing in other contexts and environments? I think someone mentioned earlier, like you might have a child that does really well in one-on-one testing if they have that ADHD presentation, or another child that won't. And so because we gather so much information, it really helps paint that picture. And if they do well with one-on-one, well, then we know that that's a support that might be useful for them. And so then what comes after that is we have a feedback session. And so this is where the neuropsychologist will discuss the strengths and weaknesses. And then as needed, they'll discuss additional diagnoses. So if we know you have ALD, maybe there is ADHD, maybe there's not. And then we'll get these formalized support programs, these individualized educational programs, and I'll talk about those a little bit more. And then they can explain health-related sensory or behavioral things that are happening. Okay, so if this is a slide that I just wanted to say, these are all of the ways that neuropsychology helps and can support your family. And so we start with, we can monitor development. So the way neuropsychology works is we have all this data and these test scores, and we have population norms. So we can compare your child to children in similar age groups, demographics, educational backgrounds, and see how does my child compare to others? And so we're able to see is this age appropriate development? Is this within a normal range? Is it not? And then we can watch that over time. So we can monitor development. I've kind of touched on caring for physical health, mental health, and behavioral health. So we're able to look at all three of those domains really well. Yeah, I'm from Minnesota, so we also love it for research and treatment development. And then those IEPs, the providing guidance to educators. This is when you go to schools, sometimes you'll see, like, teachers will have these documents that say, my child needs like a private testing room or extended time on tests and things like that. And it helps formalize through the schools what your children need to be successful and to be their best and to learn their best and show their best when they are like in school. Another fantastic thing about neuropsych, because it covers these, like, all these domains, it's used by PTs, OTs, speech language pathologists. It's really used by many healthcare providers to understand what I've been saying, but like how the brain works, how is this showing up? And so we see it in neurology. It just it ends up being a little bit of a centralized hub for many specialists to use. And then kind of having that family educational planning, knowing, oh, look, we're seeing these changes and this is maybe what we can expect over the course of your child's life. So then there are some specific things for ALD, like why do we really care about this in ALD? We see lots of kids with lots of different neurological conditions or psychological conditions, but in ALD we think it's really useful for monitoring because we can establish that baseline and we can monitor those changes over time. We can also look and see if there's updated diagnoses or updated accommodations that are needed, and then we can identify those things. For cerebral ALD, it's especially helpful in identifying before and after treatment. How did my child change? What accommodations are needed now? And are they where we would expect them to be? So those are some specific reasons that neuropsych is so helpful in ALD. These are some other notes. So in Minnesota, we really highly recommend and encourage this type of service because it's so useful, and so many of our families report that it's very useful in understanding how their child is or is not showing up in the world and how they can support them. And then for us, the families may visit often 1 to 3 years or every 1 to 3 years, and then the cerebral families tend to visit at the time of their treatments. Neuropsychologists with ALD experience may be rare. Because we know that one of the challenges we have in ALD is meeting and having specialists who maybe know, there's many of us in this room, but I'm sure many of you have had experiences that are not so positive with people who don't understand anything, and it can be really scary. So there's either opportunities to travel to sites like Minnesota, I'm sure there might be others, but then also they're always able to consult with another neuropsychologist. So even though it might be tricky to access if you're not directly near a neuropsychologist, there might be ways we can support you in getting this support because it is so meaningful. It's commonly covered by insurance, but that's always insurance specific. And then there are long wait times. And so this is one where if you're thinking about it, I would recommend finding one soon, because sometimes they just take a long time. Because the day it's a whole day with your child. So it's not a 30-minute appointment. So there's just fewer in the year. And so that was our neuropsychology outreach project that we completed with ALD Alliance, trying to find out or to answer some of the questions that families had about what is neuropsychology. And there's more information on those pamphlets about referrals and access and just more details than I could provide just in this one chat. So now we'll briefly touch on using neuropsychology as a research tool. And so one of the challenges we have in ALD is that we have many research studies that don't have the same outcomes, or they have different research protocols. So it can be difficult to understand it's difficult to pool the numbers and understand, did not mean to hit the mic. It can be difficult to understand the effects of various treatment avenues and their outcomes. And so one of our thoughts is that we would love to unify research tools and outcomes so we can compare people to each other. We have strength in numbers. That is one of our greatest assets. Weaknesses and assets. So as Dr. Rini mentioned earlier, there's been limited research to develop these tools, and so we highly encourage that we do that. Neuropsychology doesn't have to be the only research tool. In fact, there should probably be more, but we think that neuropsychology should be involved and be a player in that conversation because it evaluates so many different cognitive functions, and we're actively using it in clinics to support families. And so one of our possible solutions is that there's like an ALD neuropsychology consensus meeting. We want to understand, and basically, someone said it earlier, but put all the experts in a room and have them discuss what makes sense, what should we be doing, what do we agree to this. The MPS Society, and I have it up there, but I won't say the disease name because I will just butcher it, but they did this a few years ago. They're on their third consensus meeting. They reported that the FDA and the EMA, they unified the protocols, and the regulatory bodies immediately started saying, well, everybody needs to follow these because then we have that strength in numbers. And so they said that it was incredible for them in their research opportunities. And so we encourage that maybe that will happen here. We're not sure yet, though. So then the very last thing that I'll touch on is, so I'm working on my master's thesis, and I am studying parent stress and coping. And so we know that not only are our children struggling, but as families, you have a lot of responsibilities, you have a lot of there's a lot of burden that goes into being a caregiver. And so we want to understand this, and we want to understand, is there a difference between presentations? Not just, oh my gosh, my child has ALD and I'm stressed. We want to parse it apart a little bit more. And so we're looking at what types of stressors exist. We have a few examples. So like role function stress, like being the person who drives or gets the children what they need, medical care stress, communication stresses, and emotional stress, of course. And then we want to find out what are common and helpful coping mechanisms. We don't just want to identify what are the stressors, but we want to identify how can we support families, what can we recommend. And so this was data that was collected at the University of Minnesota and as a part of some of our larger studies. And it already exists, but throughout this weekend, I invite you to come talk to me because as I study this, I want to make sure that I'm understanding it within like your lives and what you're actually saying and hearing, and greater than just the single data points. So that is what I have today. So we talked about the Neuropsychology Outreach Project. We touched on neuropsychology as a research tool, and then my ongoing work. I haven't looked at the data for parent stress and coping, but hopefully, well, the plan is in the next year to have a really strong sense of what that looks like. And so this is me. If you would like, you can email me with questions or ask any now.
Thank you for that. That was great. Can I ask you, how do you feel about using the school-based testing? So there's like all this data on some of these kids from their IEPs for their re-evals and stuff, and I think we've struggled to figure out how to utilize that, or kids that have, like a regular behavior monitoring kind of thing.
You mean like when the school psychologists do the testing?
Either the school psychologists or, like the special ed teachers have some type of scale they're using to...
Yeah, I have not spent too much time thinking about that, but Dr. Pierpont, if you have any answers, you are welcome to weigh in on that.
I think it could be incredibly helpful, and there's no reason to duplicate testing if they've had very extensive testing. So a lot of times, like if we see a patient and they had recent testing, we might be able to shorten our evaluations considerably using some of that data to kind of round out the picture. The only thing that can sometimes be a challenge is how that information is interpreted may not reflect the full picture of the child's medical condition if the school psychologist doesn't have the same level of training in, illness, disease, kind of neurological disorders.
Can you still use it for research, or is it?
Yes. Absolutely. I think, unless there's a reason to think it wasn't valid, if a parent came in and said like, oh my gosh, like this was the worst evaluation, we don't think it, but absolutely if there's no reason to believe that evaluation wasn't conducted well, those scores could be very useful in understanding. And you don't want to repeat like extensive testing with the same instrument in a short window of time. It may be that the school psychologist or whoever's administering testing administers tests that aren't typically given to patients with ALD, and it would be helpful then to use measures where we know we've studied this and we've worked with patients and used these tests hundreds of times before. I think that data may be more easily interpreted. But yeah, I think it could be really helpful. And we, in a neuropsychological evaluation, the goal is to get as much data put together as possible from as many sources as possible. So if there is, evaluations from other mental health professionals, evaluations from school, all of that stuff can really inform to make better, more targeted recommendations.
I think the only thing I would also add is even in the clinic, what we'll do is we have those parent rating forms, but we also sometimes send them to teachers as well to get their perspective. How are the kids in school? So we really do value all of those. We want to see the child in all of the experiences. So. Awesome, well, thank you.